A patient came into my office, 72 years old, sharp as a tack, proud of the fact that he walked 2 miles every morning without fail. He handed me his medication list before I even asked. 3 blood pressure drugs, all taken exactly as directed. No skip doses, no excuses. And yet his numbers that afternoon were alarming. Not borderline, genuinely alarming. He looked at me and said, "Doc, I'm doing everything right. Why isn't it working?" That question sat with me for days because the honest answer was uncomfortable. We had given him pharmaceuticals. We had given him instructions, but we had never given him the full picture. We had never sat down and talked about what was happening inside his arteries at a cellular level, and more importantly, what ordinary foods could do to change that environment from the inside out. That conversation is what I want to have with you today. I've spent the better part of 3 decades working in cardiology. I've reviewed thousands of patient cases, studied the literature on vascular aging, and watched firsthand how dramatically outcomes can shift when people understand the biology behind what they eat. And what I can tell you with complete confidence is this: after the age of 60, your blood pressure story is not just about sodium or stress. It goes much deeper than that. And the solution, at least a very significant part of it, is already available to you, probably within walking distance of where you're sitting right now. Let me explain what's actually happening inside your body first, because the food choices will make far more sense once you understand the mechanism. Your arteries are living tissue. They're not pipes. They breathe, they flex, they respond to chemical signals, and they're constantly rebuilding themselves. When you're younger, the inner lining of those vessels, a single cell thick layer called the endothelium, produces a steady supply of a molecule called nitric oxide. Nitric oxide is essentially a biological relaxation signal. It tells the muscular walls of your blood vessels to soften, to widen, to let blood flow through with less resistance. But as we age, and especially as chronic low-grade inflammation accumulates in the body, endothelial function declines. The nitric oxide signal weakens. The vessel walls gradually lose their ability to respond. They become stiffer, narrower, and far less forgiving of the pressure changes that happen throughout a normal day. Your heart, still doing its job faithfully, now has to push harder just to move blood through a system that no longer cooperates the way it once did. This is the real story of age-related hypertension. And here is the part that most people are never told. What you eat 3 times a day directly determines how much inflammation is accumulating in those vessel walls, how well your endothelium functions, and how responsive your blood pressure is to the treatments your doctor has prescribed. Food isn't a substitute for medicine. I want to be absolutely clear about that. But food is either accelerating the problem or helping to reverse it. There is no neutral ground here. And once you understand that, 5 specific dietary choices become not just suggestions, but genuine cardiovascular tools. Let's go through them one by one. Most people build a meal around its carbohydrates. The bread goes down first, the rice fills half the plate, the pasta is the main event. This is not a moral failing. It's simply how many of us grew up eating, and it's how most restaurant meals are structured. But here's what that habit is quietly doing to your blood pressure every single time. When fast-digesting carbohydrates enter an empty stomach, blood sugar rises sharply and quickly. Your pancreas responds with a surge of insulin, and insulin, in high concentrations, triggers the lining of your blood vessels to constrict. Your heart rate increases, your pressure spikes. All of this happens silently, invisibly, every single meal, multiple times a day. Now here's the simple reversal. Eat your non-starchy vegetables first, every meal, before anything else touches your fork. The fiber in vegetables, when it reaches your stomach ahead of the carbohydrates, physically slows the rate at which sugar from the rest of your meal gets absorbed. It acts like a biological governor on your blood sugar response. The spike flattens. Insulin rises more moderately. Your blood vessels stay calmer. I've had patients who changed nothing except this one sequencing habit. Same total calories, same foods, and saw meaningful improvements in their post-meal blood pressure readings within 2 to 3 weeks. It sounds almost absurdly simple. It works because the biology is real. Start tonight. Vegetables first, every time. I know, you've probably seen it promoted for everything from weight loss to skincare, and healthy skepticism is warranted. So let me tell you exactly why this one deserves its place in a cardiovascular conversation, with no exaggeration. The key compound in apple cider vinegar is acetic acid. And acetic acid does two specific things that matter enormously for blood pressure in older adults. First, it improves how efficiently your cells respond to insulin. This directly reduces the blood vessel constriction we just talked about, because when insulin sensitivity is better, your body doesn't need to produce as much of it in response to a meal. Second, and this is the part that genuinely impressed me when I reviewed the research, acetic acid has been shown to upregulate nitric oxide production in the endothelial cells that line your arteries. More nitric oxide means more natural vasodilation. Your arteries relax, pressure drops. This is, remarkably, the same basic mechanism as an entire class of pharmaceutical vasodilators, achieved through a tablespoon of fermented liquid. 1 to 2 tablespoons diluted in a full glass of water with each meal. Use a straw to protect your tooth enamel. Never drink it undiluted. That can damage your esophagus. If you have a history of acid reflux or stomach ulcers, speak with your physician before starting. For most people over 60 with no contraindications, this is a safe, low-cost, and genuinely effective daily habit. 3 weeks. Check your numbers. Pay attention. Here is something most people, and frankly many clinicians, don't discuss nearly enough. For a healthy cardiovascular system, blood pressure is supposed to drop meaningfully during sleep. It's called nocturnal dipping, and it gives your heart and vessels a critical window of rest and recovery every single night. But many adults over 60 experience the opposite. Their pressure either fails to drop at night or actually rises during sleep, a pattern called nocturnal hypertension. It's associated with significantly elevated stroke risk, accelerated kidney damage, and greater overall cardiovascular strain. And because your daytime readings look fine, you might have absolutely no idea this is happening. Enter walnuts. Approximately 30 grams of walnuts, about 14 halves, eaten around 30 minutes before bed, has been studied in the context of nighttime blood pressure. Walnuts are uniquely rich in alpha-linolenic acid, the plant form of omega-3 fatty acid. They also contain melatonin and an amino acid called L-arginine, which your body uses as a direct precursor to, you guessed it, nitric oxide. Together, these compounds help signal your vascular system toward relaxation as your body prepares for sleep. They support that nocturnal dip your arteries are supposed to make. Think of it as gently reminding your cardiovascular system that night is the time to stand down. 30 grams, 14 halves, 30 minutes before bed. Mark it on your phone if you need to. This one is worth building into a non-negotiable habit. Across West Africa, the Caribbean, parts of the Middle East, and Latin America, there is a tart, deep crimson beverage made from dried hibiscus flowers that has been used medicinally for generations. In Jamaica, it's called sorrel. In Egypt, carcadet. In Mexico, agua de Jamaica. And until about 20 years ago, Western medicine mostly ignored it. That changed when researchers started looking at the biochemistry of hibiscus anthocyanins and organic acids, particularly hibiscus acid. What they found was that these compounds inhibit ACE, angiotensin-converting enzyme, the same enzyme targeted by one of the most widely prescribed classes of blood pressure medications in the world. A well-cited study in the Journal of Nutrition found that regular hibiscus tea consumption reduced systolic blood pressure by an average of 7 points in participants with elevated readings. 7 points is not trivial. That is clinically meaningful movement, the kind of result that earns a treatment a serious look. 3 cups daily, morning, midday, and evening. Hot or cold, both work equally well. No sugar or the smallest possible amount, because added sugar counteracts nearly everything we're working toward here. A touch of honey is fine. One important caution: if you are currently prescribed an ACE inhibitor medication, please talk to your doctor before drinking hibiscus tea regularly. Stacking 2 ACE-inhibiting mechanisms can push blood pressure too low, which carries its own risks. For everyone else, this is one of the most pleasurable tools in this entire list: a warm, ruby red cup of tea. It happens to protect your arteries at the same time. If you have canola oil, soybean oil, sunflower oil, or corn oil in your kitchen, you are almost certainly consuming them in amounts that are creating measurable cardiovascular damage, and most people have no idea. Here's the issue. These are omega-6 dominant oils, and omega-6 fatty acids, in the right ratio to omega-3s, are not harmful. The problem is the ratio has become wildly skewed in the modern diet. Research suggests the average person today consumes somewhere between 15 and 20 times more omega-6 than omega-3. That extreme imbalance is one of the primary drivers of the chronic systemic inflammation that quietly stiffens artery walls over years and decades. There's a second problem with these refined seed oils specifically. They're chemically unstable at cooking temperatures. When heated, they oxidize and break down into compounds called aldehydes, molecules that have direct toxic effects on the endothelial cells lining your blood vessels. Every time you saute something in canola oil, you're generating these compounds. You can't see or taste it, but the cumulative damage is real. The replacement strategy is straightforward. For lower heat cooking, dressings, and finishing, extra virgin olive oil. It's rich in oleocanthal, a natural anti-inflammatory compound, and in monounsaturated fats that actively support vascular health. The research behind olive oil and cardiovascular outcomes is among the most robust in all of nutrition science. For higher heat cooking, real butter from grass-fed cows, if you can find it, in reasonable amounts. Not margarine, which is made from the same problematic seed oils you're trying to eliminate. Real butter. The decades-long fear of butter was based on research that has since been substantially revised. And as someone who has spent a career studying what arterial disease actually looks like, the evidence now points clearly toward whole traditional fats and away from industrially refined seed oils. You don't need to throw out what you have tonight. Just stop replenishing it. When the canola runs out, replace it with extra virgin olive oil. That single substitution, sustained over 3 to 6 months, can produce measurable reductions in inflammatory markers, and you'll likely see it reflected in your blood pressure readings. So let's bring it all together, cleanly and simply, because I want you to actually remember this and act on it. 5 foods, 5 mechanisms, all working through the same underlying pathway, protecting and restoring the health of your blood vessel lining, reducing chronic inflammation, and supporting natural blood pressure regulation. Vegetables first at every meal. Apple cider vinegar with every meal. 30 grams of walnuts before bed every night. 3 cups of hibiscus tea throughout the day. And extra virgin olive oil and real butter in place of refined seed oils. None of these require a pharmacy. None of them have a lengthy side effect list. All of them are supported by genuine scientific evidence. And all of them work best. Let me repeat that. Work best when used alongside, not instead of, whatever your doctor has prescribed. Bring this conversation to your next appointment. Show your physician what you're planning to add. Have the discussion. Because the most powerful outcomes I've seen in my career have come not from medication alone, and not from lifestyle changes alone, but from both working in concert. My patient with the 2-mile walks and the 3 medications, he made changes very similar to what I've described today. Slowly, carefully, with his cardiologist's knowledge and support. 8 months later, his doctor reduced his medications. His inflammatory markers shifted. He told me he felt more like himself than he had in years. He asked why no one had told him this earlier. I didn't have a satisfying answer, but that question is why I keep having this conversation, because the information exists, the biology is clear, and you now have it. Start with one thing tonight, just one. That is enough to begin. Everything shared here represents general health information based on current research and clinical experience. It is not a substitute for personalized medical care. Please consult your physician before making any changes to your medication regimen or beginning any new health practice.